G'day folks, Jason Neale here. Just a quick video today on heart valve replacement. Now I'm doing this video purely because I've had a heart valve replacement. I've got a mechanical St Jude's valve. My aortic valve was replaced about 7 years ago. Now when my valve was replaced, I was frantically looking for information about how you go after the operation. You know, can you exercise? Can you do your normal day-to-day things? I couldn't really find a great deal of information, so I figured I'm gonna now do a video. I know it's 7 years later, but I've had plenty of time to get used to it, and I'm gonna do a video on how I'm traveling, what I do, and the sort of things I do during the day, to give you a bit of encouragement. So as if you're one of the guys or one of the girls waiting to go in for your heart operation and you're worrying about whether to go the pig valve, the mechanical valve, and going, oh, the mechanical valve, the only thing with that is I'm on warfarin, I don't really want to be on warfarin for the rest of my life. Look, believe me, I've been on it for 7 years now. It does not alter my life one little bit. The only thing I don't play things like rugby, I don't play contact sports, so you can't go boxing or kickboxing, because obviously you're going to get major bruising, and good chance you'll get some sort of bleeding problems. But as far as cuts and that go, I cut my leg open with a surfboard, with the fin of a surfboard, about probably 12-18 months after my operation. Now the cut was big, it went deep enough, it actually chipped the bone in my leg. Now when I was getting out of the water and I leant down and realised I'd got a pretty big gash there, I had a look at it and there was blood oozing out, obviously, but all I did was I took my shirt off. I had a sun shirt on at the time. I took it off, I tourniqueted it, and literally within about 4 or 5 minutes it had stopped bleeding. The bleeding had stopped where we took the tourniquet off, we washed it all out, gave it a clean, we put a proper bandage on it, and it didn't bleed again after that. So, you know, it's not that drastic a thing being on warfarin. It's not like you're going to bleed to death. I had all sorts of people saying to me, oh look, if you get a cut now you're on warfarin, if you get a cut, you know, you're going to bleed like a stuffed pig. That is an absolute load of rubbish. Absolute load of rubbish. In my case anyway, that doesn't happen. Okay, my INR level sits between 2.5 and 3, and I check it every month. I've got a machine that my surgeon organised for me. It checks your INR level, and it's fine. The only thing is at night time sometimes it can be a bit loud when you're trying to get to sleep, but look, you get used to that. The first 6 to 12 months, I must admit, that part of it did freak me out a bit, but you get used to it, and now it doesn't bother me at all, you know. Perfectly fine with it. I would recommend the St Jude's valve to anyone. For me it's been great. I've just taken up cycling again. Been doing cycling now for about 8-9 months. Go out every weekend with some mates of mine. I go out a few times in the week myself as well. I'm averaging around about between 2 and 250 kilometres a week on the bike. I'll push it pretty hard on some of the rides. We go for big sprints, you know. I get the heart rate right up into the 170s, 180s. I've had average heart rates over around about an hour and a half, 2 hour ride of around 140, 145, so I've been pushing it. And look, you get out there and enjoy it. Don't be put off thinking that you're not going to be able to do the things you did before. I still eat leafy green vegetables, you know, lettuce, kales, spinach, all that sort of stuff. You can still eat that. The thing I do is I don't eat any junk food anymore. I do eat cakes and all that sort of stuff. Obviously everyone has a cake or whatever now and again, but I don't eat them as often as I did before my surgery. And I had no idea that I had this heart problem before I had my surgery. So all I did was I went down for a routine checkup. The doctor said, you know, there's a bit of a murmur there, we'll go and get it checked out. Went down for a bit of a scan, an ultrasound, and they came up, said the aortic valve was leaking. And then I think it was 18 months after that, bang, my cardiologist said, mate, you got to go in and have a valve replacement done. And look, you could have knocked me over with a feather. So you know, but look, you get used to it, you get in, you get it done. It isn't as bad as you might think. It is a daunting thing, but you know, you'll come through it and you'll be fine. The main thing is afterwards, once you've recovered and you're feeling good, get back out there. If you're a sporty sort of person, you're a cyclist, swimmer, whatever, get back out there and get into it. You'll be absolutely fine, no dramas at all. My valve gives me no hassles whatsoever. It doesn't stop me doing anything. You have a look at some of my videos I've done. I've been all around Australia, 4-wheel drive, and I've been out in remote areas. You know, look, you can't let it stop you doing anything. So the reason I'm doing this video is because I figure it will give other people that are going in for it an idea on what to expect after the operation and what you can expect to start doing again. And look, you can pretty much get back to a normal life within a couple of months. You really can. It probably took me 12 months. I was a little bit tentative. I was always worried my chest was going to fall apart. But you know, I'm back into the swing of things and I've got no dramas, no problems whatsoever. You know, I recommend getting a bike, getting out on the bike and do some cycling. It'll keep you fit and healthy. Eat good foods. Try and eat the same sort of foods all the time if you're on warfarin. And if you're eating healthy foods, you know, you can eat spinach every day. You could eat a little box full of spinach every day, provided you're going to eat it regularly on all the time. Then your INR levels will stay the same, okay? Because the spinach will alter the INR level slightly, not as much as you might think, but look, you get used to it, and once you get into a routine of what you've got in the cupboard and the sort of food you like, then you can just plough away and you're perfectly normal. And I don't go, oh, you know, I had a lettuce sandwich this morning, or I can't do that tomorrow because it might put my INR level. I just do whatever I want now. It doesn't alter my life whatsoever. So from my point of view, get out there. I recommend the St Jude's valve. Didn't want the pig valve. My cardiologist didn't even recommend it for me because at the time when I had the operation done I was only 35 or 36, maybe a bit over 35. I'm now 43. So he didn't recommend I have that done because it wouldn't last. I'd need it to be replaced. But look, I phoned him up and I asked him, can I get back out on the bike? Can I do some cycling? And he said, not a problem at all. Your heart's all fine. It's functioning, no dramas. It's come back down to its normal size because my heart was quite large from the regurgitation of blood back into the heart. That's all normal. It functions normally, and I just live a normal life. And you know, if you're going in for this operation, go in there and get it done and get back out and enjoy it and keep healthy. Stay clear of all the junk foods. You don't need them. Get the good healthy stuff into you and get some exercise done and you'll be just fine. Okay, so I hope you enjoyed the video. Have a look at my other videos. There's some on different things, cycling, 4-wheel drive and all the rest of it. And you've got any comments, post them down below. I'll be happy to answer them. Thanks a lot.